This week we'll be doing views of the tibia, the fibula, and the knee. So to start with, for the tibia and the fibula, we have a 14 by 17 film. And to start with, we're going to use the AP view. So first we're going to have the patient place their leg like so. Central ray is going to be directed perpendicular to the shaft of the tibia. And we're going to try to collimate the ankle joint and the knee joint if possible. Secondly, we're going to have the tibia and fibula lateral view. So I'll show as best I can here. Be like so. Again, the central ray would be directly at the tibia shaft. Yeah, that's about it for that. We're going to collimate ankle and knee. Next, we have the knee views. We have an AP knee view. It's going to be like so. The central ray is going to be coming here, but instead of being perpendicular, we're going to drop it about 3 to 5 degrees. We're going to try to collimate the proximal tibia and fibula in the interspace between the tibial plateau and the femoral condyles. This view could also be done standing, and if it's done standing, the image receptor would be perpendicular and not at an angle. Let's see. Now we have the medial oblique view. So you're going to take the patient's going to have their leg rotated about 45 degrees. The central ray is going to be directed again at the knee space, or the knee joint space, excuse me. And we're going to have that 3 to 5 degree tilt. That's because we are recumbent. Now, if we were standing again, it'd be perpendicular. We're going to be collimating the proximal ends of the tibia and fibula, the soft tissue of the knee, and the head and neck of the. I just said that. I think in the proximal tibiofibular joint. Next, we have the lateral oblique view of the knee. Be the same idea as the other two, because we're seated or recumbent. Excuse me. We're going to have the central ray at a 3 or 5 degree tilt, down, pointed directly into the inner space here, which is, so we know it's about a ½ inch below the patellar apex. We're going to be collimating, for this view, we're going to be collimating the femoral epicondyles, the patella, and the tibial epicondyles, and the fibular head and neck. Now we have a lateral view of the knee. For this, we'd be more at an angle. This one should be done standing. Okay. So imagine I'm standing, and this will be done when you flex the knee at 20 to 30 degrees. And for this one, we're going to be using the 10 by 12 film. Oh, and I forgot to mention that. We're going to be using 10 by 12 on all the knees. Yeah, the 14 by 17 was only for these. Anywho, lateral knee, that's right. Central ray can be directed about a ½ inch below the medial epicondyle through the center field. Right there. This is also going to collimate a lateral projection of the distal femur and the patella and the joint space between the tibial plateau and the femoral condyles and the proximal tibia and fibula adjacent soft tissues.